Hey guys, welcome to Thrive Bites, the official podcast of Dr. Colin Zhu, aka the Chef Doc. On every episode, I talk with health and wellness experts from all over the world, such as doctors, chefs, dietitians, coaches, and many more. And I sit down with them and have casual conversations about plant-based lifestyle, how to elevate our emotional resilience, and what it really means to thrive. And I bring all of this to you. So let's get to this week's episode.
Let's shift gears a little bit and talk about, dentistry in general, right? I think, correct me if I'm wrong, but every dentist goes through the general dentistry, schooling and training, and then they specialize, kind of like how we go through primary care and, learning about the whole body before we specialize, right? So give us a snapshot on, just what entails general dentistry and what are basic 101s we need to know about it.
Okay, perfect. The number one question I get asked is, why do I get so many cavities? Or most patients will come in and say I've always had soft teeth, I've always gotten cavities. Usually when I do a little investigating, I usually find out the cause. And I tell most of my patients, if I'm good, I can fix every cavity that you have in your mouth. But if I'm great, I can tell you how to prevent them. And that's ideally the kind of dentist you want, right? And there's a couple things. Cavities are caused, here's a little lesson. Cavities are caused by a particular strain of bacteria, the main one being Streptococcus mutans. And it feeds on sugars, starches, and it thrives in an acidic environment. So you're eating a lot of carbs, it's multifactorial. So if you're eating a lot of sugars, a lot of carbs, a lot of starches, you're going to cause that bacteria to thrive. So it's the analogy I use is a lollipop that you drop on the ground. All the ants are going to come to that lollipop. Okay, it just flocks to it, and it goes through. It processes. It eats what we eat, which is what I tell my pediatric kids. And it produces the byproduct lactic acid, and that's what breaks down your enamel. Just this natural decaying.
It's the byproduct.
Yes. So your enamel is quite hard. It's twice as hard as your bone, believe it or not.
And what is the enamel? It's the front part of the teeth?
Yes, the enamel is the strongest part of your teeth. Right. So the tooth itself has layers. The outside layer is the enamel. That's the hardest part. When I say it's twice as strong as bone, it is. It's much harder to break. It's harder to break your teeth than it is to break your bones. But we break them because they go through quite a beating, throughout life, right? We're constantly chewing on them, eating on them. And
it's also because, our mouths are, besides our skin, it has the most exposure to the outside world, right? Because you're eating, it has to come through the mouth, go through the teeth because we have to chew or masticate, right? And it's literally being exposed to everything.
Yes. So it like I said, it takes quite the beating. So there are things that you can do to kind of keep your teeth strong and healthy. And what I was saying before about the food industry making things, the food industry basically producing things that have no regard to our health, right? So natural sugar is not that easy to find in the environment, but we were able to actually synthesize sugar. So what do? They put a ton of it in our juice boxes. They put it in everything because the sweeter it is, the more likely you're going to buy it. And we know that we talked about this where it contributes to diabetes and other chronic illnesses. But with teeth especially, it rots our teeth because now you're drowning your teeth in sugar.
And that's essentially what a cavity is, right?
Yes.
And why, that's essentially what a cavity is. And, my other question was, why is it bad? Is because it'll rot, and then what happens if you don't take care of it?
As the cavity spreads, it makes its way into the nerve, which is right at the center. I call it the core of the apple. It makes it into the center, and that nerve is connected to your brain, your heart. It's not common, so I don't want anyone to panic, but, there was a particular patient who had an abscess in his brain. And when they researched, they found bacteria that were dental bacteria that you would find in the mouth. So as that infection spreads once you have an opening that allows the outside environment, bacteria, to get into your nerve, it's now connected to the rest of your body, and where disease can really spread. And now they're finding more that dental disease, gum disease is linked to preterm birth, heart disease, and the like. So it's very important to take care of your teeth.
Right. Because once it goes, because it's kind of like not just the nerve, right? Because it can go into your bloodstream.
That's what I'm trying to say. Yes. Yeah. And so we have sugar, starches, acidic drinks, soda, anything that's carbonated is acidic. Carbonic acid is acidic, and it breaks down your teeth even more. So your teeth is eroding on top of, you're drowning it in sugars and starches. And the other, these are the things I go through with all my patients. Like, what's your diet like? Are you on any medications? Are you drinking something regularly instead of just normal water? And it's usually one of those things. Acid reflux is a contributor, but medications is a significant contributor.
Why is that?
So I can tell you, I have an array of patients who've probably gone years or decades without having had a cavity. They start on like a high blood pressure medication, and suddenly it's like one of the side effects is dry mouth. And saliva actually acts as a buffer to kind of like buffer all the acidity that's in your mouth, keeping your mouth, at a normal pH level. When you lose that, I'm telling you, the cavity risk goes up exponentially. Okay,
because of all the acidic nature of all these different kinds of food that comes in contact.
Yes, that's right. That's right. So if you talk about, when I knew I was going to do this podcast with you, I looked up a lot about how going plant-based and how it relates to your oral health. And it's funny. There's actually a lot of mixed reviews out there, and there's really been no long-term study per se, or multiple long-term studies. So the reviews are still mixed. But the way I see it is there's definitely more benefits, but you have to do it the right way. Just like they say, like, when they talk about vegetarianism or veganism in general, it's like, it's not the omission of meat, right? Like you can't just not eat meat and think that that's healthy, right? You can't not eat meat and then just eat nothing but breads and sugar. And
substitute it with something else. Kind of like the trends back in the day where, high fat and low fat and no sugar, because the food industry is very interesting and very, very skilled in terms of replacing and substitute one for another. So it's a marketing scheme where it's like, natural is a marketing, word, or, zero sugar when artificial sweetener is not considered sugar, and there's a lot of things to kind of substitute one for the other.
Yeah. So you have to kind of be aware, if you choose to go on this journey, that the idea is increasing what did you say? It was, increasing your nutrients.
Nutrient density versus calorie density.
That's right. And if you don't eat meat, but you eat nothing but pizza, that's just not going to work, right? So I think there's some research that says, like, there's a concern that people who are vegetarian tend to eat more carbs and starches, and as a result, their cavity risk goes up. But just like, like I said, going on this journey, you have to do it the right way. If you're eating the right foods, your body will get the right nutrients. And there's a lot of indirect positive outcomes. Like, if you can reduce your risk of high blood pressure, diabetes, you're off medications. That alone cuts your risk of getting cavities, right? You're cutting out all the refined sugars. You're cutting out carbonated drinks. That will reduce your risk of getting cavities. And there was research that has shown that going plant-based, helps with gum disease. There's less inflammation, right? Overall, there's less inflammation in your body when you go plant-based. So now you have less inflammation in your gums, less gum disease. You're less likely to lose your teeth as a result. So that's what I've been relaying to a lot of my patients. That diet plays a role, oral hygiene plays a significant role.
So one of the questions that I wanted to ask was, what was it like in dental school? Like, what did you receive? What did you not receive in terms of what you're finding out now? Like, do they care about, because it may seem obvious for someone that's non-dental because you're the expert of oral health, right? So, in my perception, not being dental, I would think there would be a huge emphasis on diet, right? And so, because I know in my medical training, I didn't get that much in schooling. So what was it like in dental school, that you're now realizing that you have more or less of in terms of, the knowledge you have now?
I think that, we were taught what I discussed, the basics of what contributes to high cavity risk. But they didn't go too much into nutrition and how that affects your overall health, including your mouth, because that wasn't our focus. We were looking at such direct correlations, carbohydrates leading to decay due to bacteria. But since I'm on this journey with you, I think that I've become much more aware and a better clinician as a result, I think. Take a more holistic approach to just fighting cavities directly, but attacking it from the source.
Right.
Hey guys, we're going to be taking a short break, but don't go anywhere. We'll be right back.
Hey guys, this is Dr. Colin Zhu, aka the Chef Doc. I just want to take a few moments of your time to talk to you about something that I feel needs to give reflection and pause for. Is there something interfering with your happiness or is preventing you from achieving your goals? I know for me, I've been on the self-work journey for a decade now, and I remember in my personal experiences, through my doctor's journeys and also from traveling the world, I was always searching for the next step or thinking that happiness was a destination. However, it's not. What I found instead was that life was a process, and learning about life was also a process and a practice, and that the state of happiness and the state of joy and contentment was also a practice. For those of you who don't know, since I don't share that much on my podcast, is that I actually battle with anxiety, OCD, and in the past, episodes of depression. However, little by little, step by step, after seeking extra help, I've been able to achieve monumental things in my life that I've been eternally grateful for. BetterHelp will assess your needs and match you with your own licensed professional therapist. BetterHelp is a sponsor of this podcast. It's not a crisis line. It's not self-help. It is professional counseling done securely online. There is a broad range of expertise in BetterHelp's counselor network, which may not be locally available in many areas. The service is available for clients worldwide. You can log into your account anytime and send a message to your counselor. You'll get timely and thoughtful responses, plus you can schedule weekly video or phone sessions, so you won't ever have to sit in an uncomfortable waiting room, as with traditional therapy. BetterHelp is committed to facilitating great therapeutic matches so they can make it easy and free to change counselors if needed. It's more affordable than traditional offline counseling, and financial aid is available. BetterHelp wants you to start living a happier life today. A couple of reviews. This is by Rebecca Raymer. Becky has literally saved my life by truly understanding me. She has given me self-talk strategies and different thought pattern exercises that have made me stronger and a more aware person. I am so grateful to have found her. I've been to so many different therapists and none have helped me like Becky has. This is another review for Adam Johnson. I've had counselors before, both on BetterHelp and in person through work. And Adam, by far, is the best counselor I've ever talked with. I feel like he actually listens to and what is going on. He asks questions to help you navigate your thoughts. And you can tell that he is listening and wants you to help you. Visit betterhelp.com/thechefdoc, that's better HELP, and join the over 1.4 million people taking charge of their mental state with the help of an experienced professional. Special offer for ThriveBite listeners. Get 10% off your first month at betterhelp.com/thechefdoc. THECHEFDOC. Thank you for listening, guys, and back to the episode.
Welcome back to Thrive Bites. Let's get back to the interview.
Because it's interesting when you talk about, you're saying all these different types of acids or acidic natures, and you're talking about carbs and different sugars. It's funny how, none of this, in a way is naturally appearing in nature. Like man had to kind of manipulate it to create, the cane syrup and the high fructose corn syrup and, all these different types of sugars that are in everything. It's, in our dairy products, it's in our salad dressings, it's almost in everything.
Yeah. You can't escape it.
And being a mother, does it make you more mindful, when you're reading these nutrition labels and when you're, giving it to your children? Does it cause any difference in terms of what you're giving to your children?
Oh, absolutely. I mean, like, I'm much more aware now, like I said, but I'm more aware of how it's harder to escape it, right? Because even with kids, things taste so good. The things that are so bad for you taste so good, My daughter is a picky eater, but she can spot a lollipop like 5 aisles down at the grocery store. It's like you're just
wired.
You're addicted because it's, our bodies crave sugar, right? But not this much sugar, not so much that it's there's an overabundance, and it's taking a toll on our oral health and our overall health. I believe.
I did a lecture series with my medical school alma mater with, food addiction, and how even though it's not a actual, real diagnosis, but, it is real. They've found a lot of, research in terms of the same parts of brain that substance abuse, addicts will go through, that, alcoholics and things like that, hitting the same, dopamine receptors in the different parts of our brain. And food addiction, for us, as, health champions, and for you, the gateways, for that, it's ubiquitous, it's everywhere. And it's funny how we can't escape it, like you said. Yeah. So, give us a little bit more in terms of, the one-on-one, what are we, supposed to be looking out for, in terms of brushing and flossing, how many times a day, just even though, it may seem simple, it may seem like, common sense, but I'm sure there's a lot of underlying deeper of the whys. And the best way for people, like patients, when I teach, for them to understand is teaching them the why behind it instead of finger pointing.
I agree. So a lot of new patients that I meet, I tell them at the first exam is I'm going to tell you a lot of things about dentistry that you may not know, because I think dentistry sometimes goes under-explained. And I'm obviously an over-explainer.
No, that's good.
So I always apologize in the beginning, like this will be your longest appointment where I will be talking your ear off the entire time. But what I usually tell my patients is, when we were children, were we ever explained, like, why do I need to see the dentist every 6 months and my physician once a year? Did you ever ask why?
As children?
Yeah. I was like, okay, I guess that's just what you're supposed to do, right? Mm-hmm. The dental checkup is very important, not just for, it would be nice if you're going to get cavities. To say you'll never get a cavity is impossible, but the best cavity is the smallest cavity, because if you catch it small enough, you can actually take like a fluoride toothpaste. We'll get you like a fluoride varnish to kind of help reverse it if you catch it really, really early. And if it's a full-fledged cavity, the best filling is the smallest one. We would just treat it with a small filling. It's when cavities get larger that it becomes a little bit more dangerous. Now you're closer to the nerve. Now you may need a root canal. A root canal is basically essentially a word for a deeper filling. You got to go deep into the nerve canal to clean out all of that. And it just, things get a little bit more complex, and the risk of losing that tooth goes up. So preventative dentistry is the best dentistry. Now, even with the cleaning that you get, sometimes people think of it as like a cleaning just sounds very like you're going to the spa for a facial, okay? But that's not the case. The cleaning is actually very therapeutic. You can obviously brush when you're home, but everything sometimes you're getting is above the gum line. It's all the plaque, and plaque is just another word for like leftover food mixed with bacteria that builds up and it gets stuck underneath your gums.
And is that the same thing as tartar?
Tartar is when that plaque becomes calcified. And that's much harder. You can scrub till the cows come home, it's not coming off. And as it stays and it sticks on your teeth, that's how it progresses to gum disease. And gum disease is how most people end up in dentures. Your gums and your bone recede away from this site of infection, making your teeth eventually become loose, like a fence post. Think of a fence post that's not well planted in the ground. It becomes wobbly and eventually it falls right out. When you get a cleaning, you're almost getting flushed from the bottom up, reset back to zero, and then you maintain for 6 months. And that's why it's very important to not skip that. And here's the scary thing that most people don't understand, and it's the number one question I get asked. It's like, why don't I feel anything? I don't feel any pain.
Right. So why would I even come for that 6-month visit,
Exactly.
If I can't feel anything?
And to that, I always tell my patients, like, does high blood pressure always tell you you're about to have a heart attack? It doesn't, right? Your body has a natural way of like blocking certain things because it
compensating, like our internal compensations.
Yes. And my theory is I think that in the mouth especially, if you had any pain, it would deter you from eating, which deters you from like survival. So there's a lot of like sometimes you might feel a little discomfort here and there, but for the most part, people don't feel that they might see that their gums are receding. They don't feel any discomfort until it gets very, very bad. And at that point, sometimes it's a point of no return,
So what you're saying is that you can't overemphasize coming in every 6 months.
Yeah.
Why that duration though? Is it because is that enough time, whether you do something or not do something, that you will be able to visibly see?
I think that it's just a time that the ADA, the American Dental Association, has just kind of been, for years, has pinpointed like, okay, this is an adequate amount of time, because cavities, once it starts, it can rapidly spread quite quickly. So you can't really go a whole year without seeing your dentist and having that cavity start as small, and now it's now a full-blown root canal or extraction.
Right. So what happens when that tooth actually comes out? Like what ends up, it's kind of like a link to the entire bike chain, right? And they all work together. If you have that tooth out, why is that a bad thing?
Or
if it is.
It is. So most people think that the easy way out is to just pull the tooth.
Right, and then continue on their behavior habits.
Right. And in dentistry, before dentistry was even dentistry, that's what people did, right? You have a tooth pain, you just pull the tooth, problem solved. And that's valid. It is a way of treatment of a dental infection. But there are like long-term repercussions that you don't see right away. You take a tooth out, you should always replace it with something. I recommend an implant, obviously. But the malocclusion leads to a lot of things. Teeth are not glued to the bone. They're not like an extension of your skeleton like your fingers and toes are. They are a separate entity. And when you lose your teeth, they shift. And they don't shift in like a way you want them to shift. They lean, they waddle, and
it's like the fence post. I like that visual of the fence post.
Right. That's right. And so now you have an area where, because your tooth is not straight, it's leaned, you now have an area where food is more likely to get impacted, which then it becomes almost like a domino effect, So see your dentist every 6 months.
It's so important. So we got, twice a year you would come, So tell me, I've always wondered about this. Most dentists would recommend brushing twice a day, right? So why is it? I can understand it. You go through a whole day, you're eating, you're drinking, all kinds of stuff, and you're brushing around, brushing away all those different things, washing, things like that. But when you wake up in the morning, why do you brush in the morning? Because you're sleeping, right? Like what happens during the sleeping period that you have to brush in the morning?
Well, first of all, your mouth stinks. And secondly, your mouth is never fully sterile, So even overnight, bacteria is working. So even if you brush, there are still things probably stuck to your teeth that the bacteria is making its home around your teeth. So, I brush 3 times a day. So twice is the minimum because we don't want to push it, and it's not realistic, I guess, for some patients. But you keep the plaque off your teeth. You keep the bacteria away. And that's just...
Hey guys, we're going to be taking a short break, but don't go anywhere. We'll be right back. Welcome back to Thrive Bites. Let's get back to the interview.
Is there such thing as overbrushing?
I don't think so. I mean, you can brush too aggressively where it can cause gum recession, but, you know, generally my best brushers are the ones that keep their teeth the longest. Okay. You know, hygiene is definitely one of the major factors to keeping your oral health in check.
And you would also recommend flossing as being, you know, equally as important as well?
For sure. If you brush and you don't floss, it's like, let's just wash two sides of your car. Mm-hmm. Okay? And you know, like, it's like once you start flossing, you'll be like, oh, there's that turkey.
Right, because it will eventually, you know, it could also become that plaque and tartar, but just in between, you know, the crevices, right? The in-between space, right?
Food will always, it's possible that if we didn't eat, we probably would never have like issues like gum disease or cavities. Don't quote me on that, but food is always the culprit, right? Mm-hmm. And we have to eat, unfortunately, but right. Food is also what feeds the bacteria that's in our mouth. And they thrive on that, you know. Right. And you top it off with like, you know, like I was saying, acidic drinks, more sugar. It's like an all-you-can-eat buffet in Colin's mouth.
But you have a good point, because like, you know, comparatively to that we know that are harmful to our health, like smoking and alcohol, you know, we can survive, you know, without it, right? But we can't survive without food. But it's the quality of food, and you know, I would also argue how, you know, frequent as well. So, you know, relating it back, you know, how do you see, you know, plant-based kind of shifting things? Like how, you know, do you see it being, you know, you're eating less acidic foods, you know, over like less processed and refined, less candy, less junk food that can be more inflammatory and acidic towards the mouth, you would say?
I'm already seeing a significant change, just comparing how we grew up. Because I remember, I mean, we all ate candy, you know, when we were younger. And now the younger patients that I'm seeing, you know, their parents are more aware. Their parents are more like educated. They're like, you know, I ate a lot of candy growing up. I got a ton of cavities. That's not going to happen to my kid. We don't have any candy in the house. And so I'm already seeing the change that people are getting more educated, that you just need to put that information out there, you know, not just for your oral health, but this plant-based diet. What I like about it is it's making people do a little bit more research as to how food is made, right? Instead of just taking it off the shelf and being like, oh, this is good, you know, just thinking about like what processes.
That's a new one.
What processes did it have to go through to kind of get on this shelf to sit here for weeks and weeks, you know, right. And then have you put it in your mouth?
Yeah, exactly. Well, going back to the whole vegan thing, like you can totally be unhealthy even as a vegan. You know, you can eat a Twinkie all day long. Right, you know, 3 meals a day, 365, and you know that thing could probably outlast a nuclear war. Right. You know, so. And, you know, and so it's about the quality of food. And like we mentioned earlier in the podcast, you know, it's, you know, as close to Mother Nature as possible, you know, and what's beautiful about, you know, your personal experience was that, you know, you get to be in the kitchen more, you know, you get to prepare more, because like we talked about with the food industry, you know, they don't have regard, you know, for, you know, how it influences our health. Right. You know, we have to be the champions of our own health, be the champions for our oral health, you know. What would you see different in terms of how you would educate, patients? Do you think like a format like this would help? Do you think that more time in the office counseling them would help? Like, how would you see things change if you see, like, for example, your colleagues being, more on board with this?
So I think a lot of people are on board. They just don't have access to this information, right? Whenever I talk about being plant-based, or even with my patients when I talk about, maybe you shouldn't drink seltzer water every day because it's making your teeth extremely sensitive because of all the acidity that's in there. They get it. Nobody wants to, we're totally committed to making a change if we know it's good for us.
And that sucks because I just bought a soda stream. And I love seltzer water, so.
And so that's what it is. People just don't have access to the knowledge. But hopefully you and I will change that together.
Yeah. So that's why we have a format and having, good people in the room to kind of talk about it in an open format. So I really appreciate you coming here. I think this is a nice segue to conclude. And I love asking my audience or my guests, this question is, what personally makes you thrive? The podcast is called Thrive Bites. And I just love hearing about what drives the individual, you know what I'm saying? And I've known you for a very long time, and I know that, you're super motivated, but like, what has pushed you to get to this point? Like, what has inspired you? What's motivated you?
It's like a Miss America question.
Yeah, what's your Miss America wave? Can you do your Miss America wave?
What gets me up in the morning?
Yeah.
My family at 6 a.m. every day. I would say first and foremost, my family, right? Because, once you have kids, things change. Your motivations for things change as well. I feel like people say this all the time, you want to be a better person, but it's true. I read a lot of parenting books, and it says, it speaks a lot about, it's like kids will probably not listen to what you say, but they're more likely to do what you do. Mm-hmm. Right. And so I'm very motivated by, being that example. You want your kids to grow up to be strong, independent, hardworking, assertive, but also carry very strong values with them. Mm-hmm. And you can't teach that. You got to show them that. So that's definitely a huge motivation factor for me to get me up in the morning.
To pass on those values that you want to convey to the next generation.
That's right. That's right. I believe in hard work. I think hard work is put your head down, work hard, don't complain, don't, do what needs to get done. And, you'll get where you need to get. I think the other motivation is we're only in this world for a very short time. You want to leave the world doing some good, because if you don't, I don't know. Maybe it's like that for everybody. It's definitely like that for me. It feels more fulfilling.
You want to leave an impact.
Not on a national or global scale like you.
No. I mean, really, we're not talking about like Oprah level.
But I think from an individual to individual,
right? Exactly.
Standpoint. Like if I can, in dentistry.
Because you love dentistry, right? We've been talking about half of this episode was, about, dentistry. It's like, what kind of impact, maybe on a personal individual level for your patients, like what kind of impression do you want to, leave?
Dentistry has been really rewarding for me, because, you've probably always had great teeth, but there are people who have gone through a lot in their lives, abusive marriages or drug use that really wreak havoc on their teeth. And it hurts them because, the teeth and your teeth and your hair frame, your first impression for the most part. And, when you don't have nice teeth or any teeth, it can be very debilitating. It cuts your chance of getting a good job, meeting someone you love. So when you change that for someone, those are like the best moments, is when they just cry in your chair and hug you, that's when it's worth it. That's when it's worth it. There was a time when I debated whether I should be a stay-at-home mom, but it's this is also a passion of mine too. Like being a mother is obviously the most rewarding thing I've ever done, but being a dentist feels like you're doing a lot for someone. Or that particular individual. I had a patient once that was, she had just, she didn't have a great smile, and when we fixed her up, she came in, it was night and day. She came in, her hair was done, she was wearing makeup, she was dressed up, and she was like, Dr. Khani, I got promoted at work. I found a boyfriend, And she said I think she was working at the drive-thru at Wendy's, and she said like people had driven by and remembered her, and obviously they recognized her
that kind
teeth.
of impression, right?
Yeah, and they were like, "Whoa, you did something to your smile," you know, and so those are the moments you live for, you know.
Yeah. Those it's interesting because when you think of dentistry, you don't think about those indirect effects.
Right. Because you're just fixing it, you bring me a problem, I'm going to fix it for you. But yes, it trickles, down to your lifestyle and your quality of life as well.
Awesome, awesome. So, I want to reiterate how much I really appreciate, you being here, or actually me being here because I'm in your house. And, we're filming on location, but, it's been really, really nice.
This was fun. This was fun.
And I hope the listening audiences will get, not just a basic dentistry 101 and why it's important to kind of, overemphasize some things and, those self-care tips and things like that, but also relate it back to, why plant-based has changed your personal experience and why we, emphasize on the podcast, it's important, and why we feel like, try it out, experiment it. And I tell my patients, it's very simple, I don't believe in diets, but I just tell them to eat more plants because I think everyone can afford to eat more plants in their life. And, us personally, I really appreciate our friendship and I appreciate, the communication and relationship that we've built over time.
Yeah. It's probably one of my most valuable relationships, you're one of the strongest friendships that I have. And this was lovely. This was really nice. And it felt very easy. This is like how we talk all the time.
Yeah, exactly. So, guys, this has been another episode of Thrive Bites. Thank you so much for tuning in. And if you enjoy this, please like, subscribe, and follow. And if you feel like this is a benefit for someone else, please share it. And from all of us here, thank you again to Dr. Khani Nguyen, my good friend, and we will see you on the next one. Take care, everyone.
Hey guys, if you enjoyed this, don't forget to check back to our part 1. Hey guys, that was another episode of Thrive Bites. If you like that episode, please subscribe and follow for new episodes. And don't forget to rate us on Apple Podcasts.